In the dynamic landscape of health and fitness, the terms creatine and creatinine frequently emerge in discussions, often leading to confusion due to their similar names. However, despite their close relationship, these two compounds serve vastly different functions within the human body, each offering unique insights into our physical well-being. This video aims to unravel the complexities surrounding creatine and creatinine, exploring their roles, sources, mechanisms, and their broader implications for health and fitness. Creatine is a naturally occurring molecule within the human body, synthesized primarily in the liver, kidneys, and pancreas. It is composed of 3 amino acids, glycine, arginine, and methionine. While creatine is found in various tissues, it is most concentrated in muscle tissue, where it plays a critical role in energy production. The primary function of creatine is to serve as a rapid source of energy for muscle cells. This is achieved through its role in the regeneration of adenosine triphosphate, ADP, the molecule responsible for storing and transferring energy within cells. During short bursts of intense physical activity, such as sprinting or weightlifting, ADP levels in muscle cells deplete rapidly. Creatine phosphate, a stored form of creatine within muscles, donates a phosphate group to ADP, adenosine diphosphate, to quickly replenish ADP levels. This process allows muscles to sustain high-intensity efforts for a longer duration and enhances overall exercise performance. The benefits of creatine supplementation extend beyond its immediate role in energy production. Numerous studies have demonstrated that creatine can lead to significant increases in muscle mass, strength, and power. This has made it one of the most popular and extensively researched dietary supplements in the fitness industry. Creatine monohydrate, in particular, is the most commonly used form due to its high bioavailability and effectiveness. Creatine's role in the body extends beyond its well-known function in energy production. Emerging research suggests that creatine may have a variety of other physiological effects, particularly in areas related to brain function, cellular health, and overall longevity. Creatine has garnered interest for its potential neuroprotective properties. The brain, like muscles, also requires substantial energy for its functions, and ADP plays a critical role in maintaining neuronal health and cognitive processes. Studies suggest that creatine supplementation could support brain energy metabolism, potentially aiding in cognitive function and protecting against neurodegenerative diseases such as Alzheimer's and Parkinson's. Some research indicates that creatine may enhance memory and cognitive performance, particularly in tasks requiring short-term memory and quick decision-making. Another interesting aspect of creatine is its role in cellular hydration. Creatine has an osmotic effect, meaning it draws water into cells. This increased intracellular water content can enhance cell volume, which in turn might contribute to cell signaling processes that promote muscle growth. Additionally, proper cell hydration is essential for overall cellular function, influencing processes such as protein synthesis and enzyme activity. Creatine has also been studied for its antioxidant effects. During intense exercise, the production of reactive oxygen species, ROS, increases, which can lead to oxidative stress and cellular damage. Creatine appears to help mitigate this oxidative damage by neutralizing ROS, thus protecting cells and tissues from the harmful effects of free radicals. This antioxidant function may contribute to improved recovery after exercise and potentially reduce the risk of chronic diseases associated with oxidative stress. Creatine is naturally present in various foods, primarily those of animal origin. Red meat, poultry, and fish are among the richest dietary sources of creatine. For individuals consuming a mixed diet that includes animal products, these foods provide a steady supply of creatine. However, the creatine content in food may not be sufficient to maximize muscle creatine stores, especially for athletes or individuals engaging in intense physical training. Vegetarians and vegans, who typically have lower creatine levels due to the absence of animal products in their diet, might particularly benefit from creatine supplementation. Supplementing with creatine monohydrate can significantly increase muscle creatine stores, leading to enhanced exercise performance and potentially other health benefits. While creatine is widely recognized for its benefits in sports and fitness, its potential applications extend to various other populations, including the elderly, those with neurological disorders, and individuals with muscle-wasting conditions. As individuals age, they naturally experience a decline in muscle mass, strength, and cognitive function, a process known as sarcopenia. Creatine supplementation has been explored as a strategy to combat these age-related declines. Research suggests that creatine, combined with resistance training, can help older adults maintain muscle mass, improve physical performance, and support cognitive health. This makes creatine an attractive supplement for promoting healthy aging. Given its potential neuroprotective effects, creatine is being investigated as a therapeutic agent for various neurological disorders. For example, in conditions like Huntington's disease and amyotrophic lateral sclerosis, ALS, where energy metabolism in the brain is impaired, creatine supplementation might help improve cellular energy status and slow disease progression. However, more research is needed to establish its efficacy in these contexts fully. Creatine has also shown promise in managing muscle wasting conditions, such as muscular dystrophy. In these conditions, the ability to maintain muscle mass and function is critical. Creatine supplementation may help preserve muscle strength and delay the progression of muscle deterioration, improving the quality of life for individuals with these conditions. In contrast to creatine's active role in energy metabolism, creatinine is a waste product generated from the breakdown of creatine in muscle tissue. After creatine is used by muscles for energy, a small portion is irreversibly converted into creatinine. This compound is then released into the bloodstream and eventually filtered out by the kidneys, where it is excreted in urine. The primary clinical significance of creatinine lies in its use as a biomarker for kidney function. Because the kidneys are responsible for filtering creatinine from the blood, the concentration of creatinine in the blood and urine can provide valuable insights into how well the kidneys are functioning. One of the most common methods to assess kidney function is through measuring serum creatinine levels. In healthy individuals, serum creatinine levels remain relatively stable, as the rate of creatinine production and excretion is balanced. However, when kidney function declines, creatinine clearance decreases, leading to an accumulation of creatinine in the blood. Elevated serum creatinine levels can indicate impaired kidney function, which may necessitate further diagnostic testing, such as measuring the glomerular filtration rate, GFR. The GFR is a more precise measure of kidney function, estimating the rate at which the kidneys filter blood. It is often calculated using serum creatinine levels, along with factors such as age, sex, and body size. A lower GFR indicates reduced kidney function, which can range from mild impairment to severe kidney disease, depending on the GFR value. Another method to evaluate kidney function is the creatinine clearance test, which measures the amount of creatinine cleared from the blood by the kidneys over a specific period, usually 24 hours. This test provides an estimate of the kidney's filtering capacity and can help detect early signs of kidney dysfunction. It's important to note that serum creatinine levels can be influenced by factors beyond kidney function, such as muscle mass. Individuals with higher muscle mass, such as bodybuilders or athletes, tend to have higher baseline levels of creatinine due to the greater amount of creatine in their muscles. Conversely, individuals with lower muscle mass, such as the elderly or those with muscle wasting conditions, may have lower baseline creatinine levels. Therefore, when interpreting creatinine levels, healthcare providers often consider the patient's muscle mass and physical activity level to avoid misdiagnosis. While creatinine itself is a waste product with no direct physiological function, its accumulation in the blood can indicate serious health risks. Elevated creatinine levels over an extended period can be a warning sign of chronic kidney disease, CKD, a condition characterized by the gradual loss of kidney function. CKD is associated with an increased risk of cardiovascular disease, electrolyte imbalances, and other complications. Early detection through regular monitoring of serum creatinine and GFR can lead to timely interventions that may slow the progression of kidney disease. In some cases, high creatinine levels can also be a sign of acute kidney injury, AKI, a sudden decline in kidney function that can result from conditions such as dehydration, severe infection, or the use of certain medications. AKI is a medical emergency that requires prompt treatment to prevent permanent kidney damage. Given the distinct roles of creatine and creatinine, it's crucial for individuals to approach their health management with a clear understanding of how these compounds impact their bodies. For those considering creatine supplementation, it's important to adhere to established guidelines to maximize benefits while minimizing potential side effects. The typical dosing regimen involves an initial loading phase, where higher doses of creatine, 20 grams per day, are taken for 5 to 7 days to rapidly saturate muscle stores, followed by a maintenance phase, where a lower dose, 3 to 5 grams per day, is consumed to maintain elevated creatine levels. While creatine is generally safe for most people, including athletes, older adults, and individuals with certain health conditions, it's advisable to consult with a healthcare provider before starting supplementation, especially for those with pre-existing kidney conditions or those taking medications that affect kidney function. For individuals with or at risk for kidney disease, regular monitoring of creatinine levels is essential. This includes routine blood tests to measure serum creatinine and assess GFR, as well as urine tests to detect abnormalities in creatinine excretion. Maintaining a healthy diet, staying hydrated, and managing underlying health conditions, such as diabetes and hypertension, are also critical for preserving kidney function. Creatine and creatinine, though molecularly related, serve distinct roles within the body, each contributing to different aspects of health and fitness. Creatine is celebrated for its ability to enhance muscle performance, support brain health, and promote overall cellular function. Its supplementation is widely used by athletes and has potential applications in various clinical settings. Creatinine, on the other hand, serves as a key indicator of kidney function, offering insights into renal health and providing a valuable tool for early detection of kidney disease. Understanding the interplay between these two compounds empowers individuals to make informed decisions about their health, whether optimizing athletic performance or managing chronic health conditions. In the broader context of health and wellness, knowledge of how the body produces and utilizes creatine and how it disposes of creatinine provides a foundation for proactive health management. By integrating this knowledge into daily practices, individuals can better navigate the complexities of fitness, nutrition, and medical care, ultimately leading to improved health outcomes and a better quality of life. Thanks for sticking around as we dove deep into the differences between creatine and creatinine. If you found this video helpful, give it a thumbs up, and don't forget to hit that subscribe button. Until next time, see you in the next video.